There's an overflow room in room 149 for those of you who cannot find seating in this room. We'd appreciate it. This is the Senate Standing Committee on Health and Welfare. This is meeting number 11. The date is Wednesday, March the 23rd, 2022. Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Byrd.
Here.
Senator Carroll.
Here.
Senator Givens. Senator Harper Angel. Senator Howell. Senator Kerr. Senator Meredith.
Here.
Senator Nemes.
Present.
Senator Wise.
Here.
Chairman Alvarado.
Here. All right, we have a quorum and we're established to do business. We have a very busy agenda, so we're going to ask all of our folks who are speaking today to please keep their remarks very tight. And we've got quite a few people on the agenda to speak. So first thing we're going to take up is the legislative hearing on the 2022 Social Services Block Grant. This is a requirement that we have to hear this, also for a public hearing setting. I think we've got some folks from the cabinet here. Laura Biggin, and then Tracy DeSimone is here. Hopefully they're online. I don't see anything on the screens.
Good morning. I'm here if you can hear me.
We can hear you now. Yes, if you'd like to introduce yourself to the record, please, and begin your brief testimony.
Yes, my name is Laura Beacon. I'm with the Department for Community-Based Services, and I'll try to keep this brief. The DCBS administers 5 block grants. These are programs that receive federal funding, topics such as childcare, low-income home energy assistance. This specific block grant is for social services. So this funding goes towards adult protection services, child protection services, juvenile justice. Approximately a third of this federal funding is just passed through for the Department of Juvenile Justice. And we are required to submit a plan to the federal government for how we intend to use these funds every year. And this public hearing is statutorily required before submitting that plan to the federal government. So I'll be happy to take any questions that you have about this, and I appreciate your willingness to hear this.
Thank you very much. Before we take a motion, we have a couple of questions. First, Senator Givens.
Thank you, Mr. Chairman. Total dollar amount of the 2022 Social Services Block Grant?
Yes, sir. It's anticipated to be $22 million.
Thank you.
Senator Meredith.
Thank you, Mr. Chair. And it's not a question as much as a comment. You know, this is really the first time we've talked about this. And I think it reinforces my Senate concurrent resolution 20, which I filed early in the session, to really take a deep dive into the operations of this cabinet. You know, I can't remember the last time we talked about adult protection services in a committee meeting. And it's not to criticize them, everyone. It's just to talk about the breadth of topics that we have to cover during the interim, both with Health and Family Services and with Medicaid oversight and child advisory. Again, I think this just lends support to that Senate concurrent resolution that I have filed. Again, this looks like it's a good grant. It will serve a good purpose, but I really would like to have more information about it going into this meeting today. And obviously, we just didn't have time to do it. But again, just want to comment on that. And you know, as part of I think House Bill 174 today, we made an amendment to that to include my Senate Bill 43, which changed the reporting requirement for Medicaid oversight and our Child Welfare Advisory Council. And again, it's not to eliminate those at all, but in anticipation that maybe we can restructure the cabinet and maybe our committee structure so we'll have more access to information like this on a more timely basis. But thank you, Mr. Chair.
Thank you, Senator Givens.
Mr. Chairman, thank you, and I'll be brief. I want to echo what Senator Meredith has just said, and I did dig deep in the packet. Staff always does a great job of putting things in there. I would encourage all members on the committee to reinforce what Senator Meredith has just said. It is $22 million of federal funds. It's $260 million of non-federal funds for a total of $283 million that, as Senator Meredith indicates, we're going to take about 5 minutes and sign off on. Thank you, Mr. Chairman.
Staff is letting me know that the full block grant is on the committee website for those who want to be able to peruse all of it in its details. That would be the opportunity to be able to take a look at that. Any other comments, questions? Okay, so we do have a motion and a second. All those in favor signify by saying aye. Anyone opposed? All right, we'll show that the grant has been reviewed. Thank you very much for coming and presenting today.
Thank you.
Appreciate it. All right, the first bill we're going to take up is going to be House Bill 777. I think members of the committee remember that we took this up at our last meeting, had quite a bit of lengthy discussion. We provided a deadline for those who were present. They fortunately, through the help of the sponsor, Representative Fleming, and through Senator Givens, were able to come to an agreement. We have a new substitute before the committee, which is a proposed Senate substitute number 4. I'll entertain a motion on its adoption. We have a motion on the sub. Is there a second? In a second, all those in favor, please signify by saying aye. Anybody opposed? All right, the sub is before us. Representative Fleming, if you could please briefly tell us what the sub does.
Yes, sir, I will. Thank you, Mr. Chairman. I want first of all, want to thank you for your leadership and your help and guidance through this, but I also want to point out Senator Givens for his involvement in making sure this comes to fruition. Without him, I don't think this materialized. So I want to personally thank Senator Givens. The things that we came to conclusion, which everybody is supportive of that, including KCO, is under Section 9(b). Basically, it provides the cabinet to send out notices to all parties in terms of cities and counties that a certificate of need proposal has been submitted, and that they need to, or they have the option to provide a letter, either support or not support of this process. If they do not provide anything within 30 days, it automatically goes into basically his approval. That's the first thing. The second thing is basically it sunsets the all of Section 9 of Certificate of Need basically to July 1 of 2026. Senator Givens had good insight, and that basically pushes more emphasis on task force to make sure we go through a very diligent, thorough process to look at Certificate of Need to see its pros and its cons in doing that. And the last thing, Mr. Chairman, is basically, just so I want to follow what we just said, under Section 23A, it states that the need or the lack of a certificate of need process for the ambulance services are needed. So, and I think I've covered the other things that came out at the last meeting that we had with you. So that's what the changes are.
Very good, thank you. Any questions on those changes? We have a motion on the bill. Is there a second? We have a second. Senator Givens, question.
Very brief comment, Mr. Chairman. First of all, Mr. Chairman, thank you for the challenge you gave us and the latitude to go to work without you giving us space to go and try and do. We could not have done this. Representative Fleming, you and your colleagues in the House did a masterful job of getting this document in the shape it was in, getting it to us, and then causing all of those engaged and wanting to engage to come together. And I appreciate all of the parties gathering and working and trying. I want to delicately amend your statement just a moment ago in a positive way. Thank you for your kind words regarding my small involvement in it. The folks from KCO very willingly came and engaged, and I appreciate them doing that, led by Jim Henderson, and it was a challenge for all of those to gather around the table. They did so with a desire to get to good policy. I think KCO's place is not a place of support, but I sense that their opposition has now been moved to a place of neutrality as it relates to the legislation, and I appreciate their willingness to make that move in light of some of the changes that you were willing to make in the sub. So thank you, Mr. Chairman.
Thank you. Senator Wise.
Thank you, Mr. Chairman. I also want to echo words of Senator Givens. I appreciate the work that was put into this. Thank you, Representative Fleming, for coming together and bringing the parties together with work from where we were the last time in this meeting. My question is on page 28. That is Section 8. B2 right there. I think it starts with line 18. Was that also in terms of your deliberations and discussions that went on with KCO and others? Was there any change in what was put forth in that lines 18 through 22?
No, sir.
So that was original language from the previous bill that we had?
That's correct.
Okay. Was there any discussion in those deliberations that you all had of making amends to that?
Not that I recall.
Okay. Thank you so much. Thank you, Mr. Chairman.
Thank you. Any other questions? If not, we have a motion and a second. Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg.
Aye, and explain my aye vote.
Please
Sir,
proceed.
I really appreciate the work you've done on this. This will have an impact
Thank you.
towards the good for the facilities that I work at, and it really matters. So thank you.
Thank you, Senator.
Senator Carroll,
Vote aye, and a great job to all who managed to get this settled. Thank you, Mr. Chairman.
Thank you.
Senator Givens, Senator Harper Angel, Senator Howell, Senator Kerr, Senator Meredith, Senator Nemes,
Aye.
Senator Wise, Chairman Alvarado.
Aye. The matter passes with a count of 10-0. I'm willing to entertain a motion for consent. We have a motion. Is there a second? Second. All those in favor, please signify by saying aye. Aye. Anyone opposed? Representative
Amen.
Fleming, it's on consent.
Amen.
Which I say with a smile.
No complaints there,
I
sir.
would encourage you, sir, on the House side to
We-
get this passed post haste once it comes back to you.
we shall. Thank you very much, and your indulgence. Thank you, sir.
Thank you so much. Appreciate all the work that's done on that bill. Next, we'll take on House Bill 512, an act relating to heart attack response and treatment. The sponsor is Representative David Mead. There is a proposed sub on this bill as well. You have a motion on the sub. Is there a second? You have a second. All those in favor, please signify by saying aye. All right, it is passed. The sub is before us. Speaker Mead, the floor is yours. You'd like to introduce yourself and your guest.
Thank you, Mr. Chairman. My name is David Mead, and I will let Mr. Haley introduce himself.
My name is Adam Haley, and I'm the Director of Public Policy for the Kentucky chapter of the American College of Cardiology.
Thank you, Mr. Chairman and members of the committee. I'll be very brief as possible anyway. House Bill 512 is an act relating to heart attack response and treatment. What we're doing is requiring the Department for Public Health to designate licensed hospitals as Level 1 comprehensive cardiac centers, Level 2 primary heart attack centers, or Level 3 acute heart attack ready hospitals, and to expand the protocols of emergency medical service providers to include trauma, cardiac arrest, and heart attack. Of the three most time-sensitive emergencies, trauma, stroke, and heart attack, treated and transported by our EMS, only heart attack does not have designated legislation in our state. And there are currently 27 certified and accredited heart attack centers in Kentucky, and by the passage of this legislation, we know that will increase and that outcomes will improve for our patients. As you know, in 2010, we passed stroke legislation in this body, and that is what this legislation is sort of tailored after. In 2008, there were 6 certified stroke centers in Kentucky, and since we passed that legislation in 2010, the number of certified centers has grown to 41. But the best thing is that relating to stroke, hospital mortality decreased from 11.7% to 3.6%. And for those being discharged to home, the percentage grew from 28.4 to 48%. This legislation comes from the Kentucky Heart Disease Stroke Prevention Task Force. It has been on a recommendation of theirs for the past 6 years. And this bill, with Kentucky being one of the states leading the nation in heart attack and heart disease, this bill is strictly designed to improve the quality of care and save lives. And, Mr. Chairman, that's what the bill does.
We have a motion on the bill in a second. First, before we take a vote, I want to thank you for this. I know you've worked with the Hospital Association. I know the original draft, a lot of changes done in the sub for those who are curious. On Section 2, Subsection 3, we use the word any for certifying bodies, and then also there was a request for a bit more time for the department to be able to establish regulations on this. We went from 60 to 120 days on page 3. Again, thank you for your work. This is going to be very similar to what we did with Stroke Certified, which has worked really well for the state. Any other questions? Madam Clerk, please call the roll.
Senator Rocky Adams, Senator Berg,
Aye.
Senator Carroll,
Aye.
Senator Givens, Senator Harper Angel, Senator Howell, Senator Kerr, Senator Meredith, Senator Nemes, Senator Wise, Chairman Alvarado.
Aye. Aye. The matter passes unanimously 10-0. I'll entertain a motion. Consent. There's a motion. Is there a second? Second. All those in favor, please signify by saying aye. Aye. Any opposed? All right. The matter goes on consent. Mr. Speaker,
Thank you, Mr. Chairman and
congratulations.
members of the committee.
Thank you very much.
Thank you very.
Next, we're going to take up House Bill 362, which is an act relating to substance abuse intervention and declaring an emergency. Sponsor is Chairwoman Kimberly Mosier. Chairwoman, if you'd like to introduce yourself and any guests that you have for the record and begin your testimony.
Thank you, Mr. Chairman, and thank you, committee, for giving us some time to discuss this matter. I do have a guest from the Attorney General's office. Blake. Is he out in the hallway? Yeah. So I'll go ahead and get started, though. I am Representative Kim Mosier. I represent the 64th District, and this is not a new matter. This is regarding a bill, thank you, which was actually passed in 2004. Casey's Law has been around for a long time, and this is an update to that existing statute. It's Casey's Law is court-ordered involuntary treatment upon the petition of the court by a loved one to help individuals suffering with substance use disorders get the treatment that they need. And I will allow my guests to introduce themselves, and then I'll say a few more things about the bill, but it's a pretty simple fix today.
Good morning, Blake Christopher with the Attorney General's Office. Real briefly, I'll go through the two changes, and happy to take questions from anyone who may have them. This bill proposes two changes to Casey's Law that we think are really clarifications to what is either existing law or what is already operational law that's going on in these hearings. The two changes are these. The first is establishes a beyond reasonable doubt standard that an individual has to meet before he or she can be committed to treatment. We think there are some who think that as of right now that a preponderance of evidence standard is what's being used in Casey's Law and is what is being required before someone can be committed. We disagree with that, but we think it's worth clarifying that this is the standard that should be used. We think beyond reasonable doubt standard is the right one given the civil liberties that are at stake, and we don't necessarily think it's going to have a chilling effect on the folks who can get the treatment that they need, nor do we think it's going to have a negative impact on the number of people who submit Casey's Law petitions, because in reality, our experience has been a lot of judges are using this standard already, and we haven't run into a number of families who are thinking about burdens of proof and standards of proof when trying to submit a Casey's Law petition. So we're hopeful that this will not have a negative impact on folks getting the treatment that they need. The second change is regarding the cross-examination of the medical professionals who testify at the Casey's Law hearings. We believe that it's existing law that those individuals who submit medical testimony saying this person needs to go to treatment, we think it's existing law that they can be subpoenaed and required to testify and be available for cross-examination. There are those who disagree. The second change simply writes into the Casey's Law specifically that they may be the subject of a civil subpoena and can be made to come testify. We did write into, Representative Moser did write in the ability for those folks to testify remotely in order to cut down on costs to the families. I will leave it at that as to the changes. I will note before I turn it back to Representative Moser, there is a bit of urgency here. March 15th, there were two constitutional challenges to Casey's Law that were heard by the Kentucky Court of Appeals that Matt Kuhn from the Attorney General's Office argued. And we think that that court is going to may be interested in what the General Assembly does with 362. So with that, I'll turn it over to Rick.
We have a motion on the bill. Is there a second? Second. You have a second? Unless, Madam Chair, that's anything else to say. If not, we'll...
I don't. If you would indulge Mrs. Wethington for 1 or 2 minutes, I think that it's really valuable to hear from her perspective why this is important.
Very briefly, I know we've got a busy agenda, so we're trying to get through things. Just very, very briefly, if you could, please.
Thank you.
Absolutely, and I appreciate the opportunity. I am Charlotte Wethington, Casey's mom. There was no law when Casey died. We had nothing. And but for the past 18 years, because of Casey's life and death, we have had a law that has enabled families to intervene on their loved ones before incarceration or death. And so we know from reports from the AOC it is being used, and we know from anecdotal records that it is being successful. And we have never heard of anybody that has talked with us or written us that they have felt that their rights were violated. In fact, they are extremely, and I can't stress that enough, extremely grateful that someone did for them what they were not able to do for themselves because of the damage that addiction had done to their brain. So this, if we ever needed, Casey's Law, and to strengthen and be able to make it more effective for families, we need it now. So thank you. Thank you very much.
Thank you very much. Appreciate that. And I volunteer to do these for free for folks in my community when they can't find doctors willing to do them. I know how important this is for a lot of folks out there. Madam Clerk, please call the roll.
Senator Rocky Adams.
You explain my I vote.
Please proceed.
And this is a great bill. These are great changes. I actually have a girlfriend who invoked Casey's Law, changed their life. Her son is stable. Their family dynamic is back to normal. And so it's fantastic. So thank you.
Senator Berg.
And again, I want to say thank you so much, because you have really, really, from your own horrible trauma, changed this state for better. So thank you.
Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes on a count of 10-0. You have a motion for consent. There's a second. All those in favor, please signify by saying aye. Aye. Anyone opposed? Congratulations. The matter goes on consent. Appreciate you being here today. Next on the agenda, we're going to take up House Bill 529, an act relating to the disclosure of laboratory test results and declaring an emergency. The sponsor is Representative Timoney. There is a sub on this bill. You have a motion on the sub. Is there a second? Second. All those in favor, please signify by saying aye. Aye. Anyone opposed? All right, the sub is before us. Representative Timoney, welcome to our committee. Please introduce yourself and your guests and begin your testimony when you're ready.
Thank you, Chairman. Thank you, committee. It's an honor to be before you today. Being short-winded is a specialty of mine, especially with if you ask me to go up any stairs or have me tie my shoes. So we will be on point today. My name is Killian Timoney. I'm the state representative from the 45th District, and I'm going to let my guests introduce themselves.
Thank you very much. I'm David Danhauer. I'm the Chief Medical Information Officer at Owensboro Health.
My name is Suzanne Arnold. I'm a medical oncologist at the University of Kentucky and the Associate Director of the Markey Cancer Center.
Committee, I'm going to basically kind of describe what the bill does, and then I'm going to give my guests an opportunity to explain why it's necessary. This bill mandates a timeline that medical provider has to contact a patient to go over lab results in a narrow set of circumstances. Patients who may be facing a fatal diagnosis deserve a qualified health professional to help them interpret those very limited types of medical tests. In summary, those tests revolve around radiology tests, pathology tests, and any tests that would reveal certain genetic indicators.
We, as physicians, we are quite concerned that patients are receiving deadly, life-threatening diagnoses on their phones without any medical care or medical support. We have numerous accounts of patients being harmed because of that and causing harm to themselves. We ask that we, with this bill, allow our providers time to review, contemplate a plan, and set up appropriate consultation with those patients to go over that in that patient-physician relationship that we want to try to maintain.
We believe 72 hours is the appropriate length of time in order to do that, and we hope that you will help us, help all Kentuckians to have their care taken with serious diagnoses like this in a timely but sensitive manner so that we can do that face-to-face in the majority of situations.
Right, you have a motion and a second. Before we take that vote, I want to say, Dr. Arnold, it's been a while, so it's good to see you. It's days of training, so it's been a long time, and I appreciate you helped educate me as a physician as well. We're in the era of electronic medical records, and I think it's important for everybody to know that we've created an access portal for people to be able to see their own results, see their own electronic medical records. It used to be a chart was a doctor's own notes to remind them of what to do for their patients, but somehow that's become now a legal document for attorneys, for insurance companies, for government. And now patients have access and often don't know when they see something of bad news. It's better to have that communication. I think this is a great bill that needs to happen, so I commend you for it. Senator Berg.
I just wanted to really, really thank you from the bottom of my heart as a healthcare provider for bringing this bill and for both of you for being up here to speak to it, because I mean, this can be a horrible, horrible situation for patients. I mean, imagine honestly opening up your telephone and seeing a report that says advanced metastatic cancer. Yes. And you don't even, it's 5:30 on a Friday night, you don't even have anybody to call. That's unethical. I think that is truly unethical. Doctors are required to have a plan for a patient. You don't just tell somebody you're sick and you're alone. And this takes that ability away. And I can't tell you how many phone calls I've had from friends and families and neighbors, explain this to me, and I'm not their doctor. Right. I am not in a position to do this. So I just really, really thank you from the bottom of my heart. I encourage every member on this committee to vote yes. This is really important legislation. So thank you.
Any other comments? If not, we have a motion and a second. Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg.
Aye.
Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howell. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes unanimously with a count of 10-0. We have a motion for consent. Is there a second? There is. All those in favor, please signify by saying aye. Aye. Anyone opposed? Matter goes on consent. Representative, thank you.
Thank
Doctors,
you.
Thank you for being
Thank
here
you, Chairman.
today.
Thank you, committee.
Appreciate you. All right. Next, we're going to take up House Bill 502, which is an act relating to genetic information. The sponsor is Representative Danny Bentley. Representative Bentley, we have a couple of bills for you, so we'll have you be at the table for a little while. If you'd like to introduce yourself and any of your guests, and please begin your testimony.
My name is Danny Bentley, District 98 in the Great Commonwealth of Kentucky.
Bob Babbage, co-founder for Ancestry.com and 23andMe.
And Richie Engelhardt, Head of Government Affairs for Ancestry.
DNA is your personal genetic diversity based upon the chemicals in it, nitrous base, and everybody knows that since this is the Health and Family Services Committee. But today a number of companies have direct-to-consumer genetic timing. Those can cost up to $100 to $300, but we need to put guardrails on that. Current federal genetic privacy protections currently in place stem from several laws, including HIPAA, Genetic Information Non-Discrimination Act of 2008, and the Federal Trade Commission. At the federal level, neither the Federal Trade Commission nor the Food and FDA and the vast majority of laboratories, they don't provide that protection. DNA theft can result in exposure of medical information such as AD or predisposition to cancer, like we were talking a minute ago. DNA theft can reveal information about your family relations and whatever the nature of that DNA thief seeks. It may be for blackmail, paper records, cyberspace, or physical. So we need to protect that of all Kentuckians. So you get a minute.
Excellent. Thank you, Chairman Alvarado, members of the committee. I know you got a busy agenda, so I'm going to scrap my longer prepared testimony and just make three main points. One, this bill will put consumers in control of their genetic data completely from start to finish when they engage with direct-to-consumer genetic testing services. Two, this bill has had broad stakeholder and bipartisan support in the states where it's already passed. That includes Arizona, California, Utah, and Wyoming. And three, this was taken up at the Council of State Governments meeting back in the fall and adopted into their model state bill book. So we strongly encourage a favorable report by the committee, and I'm happy to answer any questions.
Very good. Appreciate your testimony. Any questions from members of the committee? We have a motion. There's a second. Very good. There's a second. Any other questions or comments? If not, Madam Clerk, please call the roll.
Senator Rocky Adams. Aye. Senator Berg.
Aye.
Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howell. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 10-0. Is there a motion for consent? We have a motion and a second. All those in favor, please signify by saying aye. Anyone opposed? All right, the matter is on consent. Thank you very much. I commend you on that. That's actually really good legislation with obviously an up-and-coming technology. We have to make sure we protect the folks in the Commonwealth. The next item on the agenda is going to be House Bill 364, which is an act relating to the Rural Hospital Loan Fund and declaring an emergency. Sponsor is again Representative Bentley. We've got a sub before us that has been prepared, and we'll entertain a motion on that sub.
Right here.
There's a motion. Is there a second? Second. All those in favor, please signify by saying aye. Aye. Anyone opposed? All right, the sub is before us. Representative Bentley, again, if you'd like to have your guests introduce themselves and begin your testimony on this bill.
My name is Danny R. Bentley, District 98, the Great Commonwealth of Kentucky.
Good morning. I'm Jim Musser. I'm the Vice President for Policy and Government Relations for the Kentucky Hospital Association.
Senator Philip Wheeler, 31st District.
Hi, I'm Jessica Burke. I'm the Senior Vice President for Legal and Government Affairs at Addiction Recovery Care.
In 2020, we passed HB 387, which was the rural hospital bill. It said if you had less than 50,000 people in a county in Kentucky, that you could draw from this fund if you needed it for your personnel, building, or new medical technique. And that went to the cabinet when we made regulations on it. The one thing we forgot to do was to put a hospital in it that was going to be repurposed. So this bill brings it up to date, where if you close a hospital and we want to repurpose it within 36 months, you can. So, Jim?
I'd like to start by thanking Dr. Bentley for his commitment to rural health care, and this is really both a bill that will improve access for those who are suffering from opioid addiction, but it's also a great economic development piece because it allows hospitals that have been closed to be reopened. And we all know that no community thrives economically unless it has a hospital in it. They are economic engines, and this bill will be a great benefit to all of our people, but particularly for rural health care. So thank you, Dr. Bentley, for bringing this.
Thank you, Jim. Senator Wheeler.
Senator Alvarado, I work with Representative Bentley on the Senate Committee substitute you have before you. I want to thank Senator Givens and Senator Meredith for their input on this. We've worked with Senator Bentley to tighten up some of the guidelines here. Addiction Recovery Care is one of the largest employers in my district, and I think that the project that Senator Bentley talked about is especially important since they intend to go for a broader mental health care wing so that they can take patients who are in distress. That's something that's sorely lacking in eastern Kentucky. So not only will this be a great economic development tool for rural areas that have suffered during the pandemic, this will allow people that are in need in the 31st District and throughout eastern Kentucky to really get the kind of care they need. So I want to commend Representative Bentley for his bill and for working with us to get, I think, what is an improved version.
You get 30 seconds.
I just want to add that I thank all of you for working on this bill. It will benefit Addiction Recovery Care, but this will also benefit a lot of other rural hospitals. So what this does is tighten up and say that if a hospital has closed, they can access these loan funds to reopen or be repurposed, whereas before, this loan fund was not available for those purposes. So while we're here today on behalf of, at least I'm here today on behalf of this one project, this will be beneficial going forward for other projects in the state.
Thank you, Mr. Chairman and committee.
Thank you so much. I want to commend you as a sponsor. Also, Senator Wheeler, Senator Meredith, Senator Givens. You've worked on the sub, which I think brings a lot of ease to a lot of folks and the changes that you've made into it. I know there's another bill that you've got, another loan fund also, that you may want to consider similar changes to that bill for us to be able to consider that moving forward as well. But we do have one question from Senator Meredith.
Thank you, Representative Bentley. And I know this is a passion that you and I share, and appreciate you working on this. And I guess my question is for Mr. Musser. I'm beginning to wonder whether the fund is going to be large enough to take care of all the healthcare needs of rural Kentucky. But just like you to put in perspective for me, how many rural hospitals do we have that were viewed as financially fragile before the pandemic, and where are we today?
Thank you for that question, Senator Meredith. Kentucky continues to struggle, and the pandemic was no friend to our hospitals, either rural or urban. We received a new report out of Washington, D.C. just last week indicating that 12 of our hospitals in rural areas are in distress and 4 of those at severe risk of closure. So anything that the General Assembly might be able to do, if there are funds available that could go into the loan fund, that would certainly be a great benefit to this effort to save our rural hospitals. As we know, health and wealth are inextricably intertwined, and in order to have a healthy community, there has to be economic growth, and there has to be a thriving hospital so that there's both access to care and so that it can help to attract the kind of economic growth that the community needs too.
Yeah, in particular with healthcare, it's like which comes first, the chicken or the egg, and we forget that 60-70% of the health social determinants, and the biggest, I think, challenge is poverty in rural communities, and how do we ever address that if we don't have a foundation to build upon? And to me, that's healthcare and education, and it's particularly healthcare is very, very fragile right now. Very appreciate the legislation we passed last year that helped improve reimbursement for hospitals, but I don't want to leave a false sense of security that that's going to solve the problem, because it's not. I think it gets us to a where we're trading water, but it's not getting us out of the water. So this is something we need to monitor closely, and look forward to working with Representative Bentley in the future and see what else we can do to help protect the very fragile rural healthcare delivery system. But I appreciate the bill and appreciate the information. Thank you.
Thank you.
Thank you, Senator Givens.
A brief comment. Appreciate the work that all four of you at the table have done on this. Senator Wheeler, thanks for your leadership in making this work on the Senate side. We had lots of conversations about it. A quick alert to all committee members. Senator Meredith has often made his voice heard about his passion for rural hospitals, and I was reminded of that recently. Politico had an article about 4 days ago highlighting the impact as it relates to rural deaths within the proximity of closed hospitals. And if you want to look at a very, very telling article about the impact of the 50 counties with the highest COVID deaths per capita, 24 are within 40 miles of a hospital that has recently closed. It's impacting our state. It's impacting our nation. The studies indicate that over 450 rural hospitals across the nation are at risk of closure. So I would encourage all members, Mr. Chairman, to take a look at the Politico article. Thank you.
Thank you. Any other questions? If not, we'll entertain a motion on the bill. You have a motion. Is there a second? Second. Any other discussion? Madam Clerk, please call the roll.
Senator Rocky Adams. Aye. Senator Berg.
Aye.
Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 10-0 unanimously. Is there a motion for consent? You have a motion. Is there a second? Second. All those in favor, please signify by saying aye. Aye. Anyone opposed? Matter goes on consent. Representative Bentley, thank you so much for your work.
Thank you,
Appreciate
Chairman.
you all.
Thank you, committee.
Thank you, Chairman.
Thank you much. Next item on the agenda will be House Bill 174, an act relating to postpartum Medicaid coverage. The sponsor is Representative Mackenzie Cantrell. We do have a substitute on this bill, and I'll entertain a motion on. You have a motion on the sub. Is there a second? We have a second. All those in favor, please signify by saying aye. Aye. Any opposed? All right, the sub is before us. And just to clarify the sub, Representative, welcome. I just want to, the underlying bill is untouched. Representative Moser is going to speak to a amendment she has. We also have Senate Bill 43, which is a bill that was passed by this committee and by the Senate that I know that Senator Meredith can speak on as well. So, Representative, if you'd like to introduce yourself, please begin your testimony when you're ready.
Thank you, Mr. Chair and members of the committee. My name is Mackenzie Cantrell. I'm the House member for Kentucky House District 38. This is my first time presenting before a Senate committee, and I'm so grateful to you, Mr. Chair, and the members for hearing House Bill 174. As you alluded to, Mr. Chair, House Bill 174, as it passed originally in the House, was a very simple language change, but a very important one in terms of keeping moms healthy in the Commonwealth. It's a 7-word change. It's there on the sub on page 1. It makes mothers who are on Medicaid eligible for Medicaid for up to 1 year after delivery of the child. So I think about my own mother, who's the most selfless person I've ever met. Sometimes moms, when they become moms, do not take care of themselves as they should, and they ignore health problems. And we need moms to, especially low-income mothers who might be choosing between taking care of themselves and taking care of their children, to prioritize their own health, because that's getting those problems addressed early is going to lower our healthcare costs and be good for society going forward. And you also alluded to that there are some other language changes in the bill, and Chairwoman Moser has been my partner in House Bill 174 throughout the process. And she was a lot more involved in the language changes in the other parts of the bill, and we'll be happy to address those and answer your questions. Thank you.
Chairwoman,
Yes.
if you'd like to explain your portion of the bill.
Absolutely. For the record, I am Representative Kim Mosier, and I just want to echo the sentiments about the original language. We know that Kentucky's maternal mortality rate is very, very high, even why can't I speak? It rivals third world country numbers, which is unacceptable. And we know that this is a huge issue, and this change really targets Medicaid dollars to programs that we know work. We have a huge rate of maternal substance use disorders, and this certainly greatly impacts our maternal mortality rates. And I just want to say that by extending Medicaid coverage to our new moms in the year following birth, if you save the mom, you save the family. And this is a real opportunity to make a difference in those moms' lives. Now, the changes in the committee sub, the first change that I'll talk about is something that was brought to me by Volunteers of America and some other treatment providers that really it was a problem that resulted from some changes made to our welfare reform situation a couple of years ago. What it talked about is the moms whose babies were born with neonatal abstinence syndrome, if they were already on medication for addiction treatment, then their parental rights, their parental rights termination were not affected. But if a mom presented at the hospital in labor, having never had treatment and never had the opportunity, she presented at the hospital in active addiction, then she was not afforded those same resources. And so this change just says that if a mom presents an active addiction, that she will be offered, if she agrees to this, a court-ordered assessment and by a drug treatment provider, and then assignment to a certified peer support specialist. And this all needs to happen before she's discharged from the hospital. And she still has to enroll in treatment within 90 days, but we just didn't want to give DCBS that kind of power to come in and remove the child if the mom was willing to get help. So that is what this change does. And then I know Senator Meredith wanted to add some language from Senate Bill 43, which changes the reporting out of the Child Welfare Oversight Committee. So I don't know if you want to add to that. I think
Thank you. Senator Meredith, you might want to explain that portion. We've passed it out of this committee before.
Right.
I will speak briefly to this, and this is really a two-step process. Senate Bill 43 is really driven by Senate Current Resolution 20, which I made reference to earlier. And this resolution calls for the creation of a task force to look at the operations of our Cabinet for Health and Family Services. Again, not a criticism of anything that's happened in the past or problems we anticipate in the future, but it's become a massive cabinet. And I made reference to this earlier when we were talking about the block grant that we approved this morning. And it's just trying to look at ways that we can be more effective as legislators and be more responsive to our constituents. So in anticipation that Senate Concurrent Resolution 20 would pass, again creating this task force, that if we do take steps to maybe elevate the committees of Medicaid oversight and child advisory, that we have some reporting responsibilities that currently call to go to those committees. So what the language does in this bill is change that reporting relationship on a temporary basis to LRC, who would then be responsible for distributing information to the appropriate parties as need be. If no substantive changes come out of the task force, then next January we would take steps to realign that reporting relationship again. So it's rather academic. Thank you.
Very good. Thank you. We've got a couple more folks who want to speak to this bill. I'm going to ask you to come forward just 1 minute, because I think we have the support for this bill, and we've got under a time crunch. I think Holly Hudnall and Christina Libby are here. If you'd like to come forward, just very briefly introduce yourselves, and please, just 1 minute of testimony. I understand you want to speak in support of the bill.
Thank you for allowing me 1 minute to speak. My name is Holly Hudnall. I am currently the Story Banking Coordinator with Kentucky Voices for Health. But back in 2012, I was getting ready to start my first year of graduate school at Western Kentucky University and was shocked to find out that I was pregnant. I had student health insurance that did not offer maternity benefits. So eventually I applied for and received Medicaid. My beautiful and healthy 10-pound, 10-ounce daughter was born in March of 2013. 3 weeks later, I took final exams. 2 weeks after that, 5 weeks after she was born, I graduated, which ended my student medical coverage. And then 3 weeks after that, my Medicaid ended. I had a lingering issue with my C-section. I had hypertension. I had gestational diabetes. It would have cost me out of pocket to follow up for those, so I did not follow up. 4 years later, I would have to have surgery to repair that issue with my C-section incision. I'm still on medication now for my blood sugar and hypertension. So I know that not following up has consequences, not just for me, but for my family as well. So I really am quite grateful for the support for this bill. I think that extending that postpartum coverage is a good idea. I know that my story is not unique. That's what makes it so unfortunate. And I think that this bill will go a long way toward rectifying that.
Thank you, Ms. Hudnall. Ms. Libby, very briefly.
Yes, I just want to say my name is Christina Libby. I'm the Health Outreach Navigator with the Homeless and Housing Coalition of Kentucky. And in my personal experience, the biggest thing is that I had both, as I was able to speak with you all previously about mental health issues in the postpartum period, but also physical health issues that thanks to the Medicaid coverage that I had were also covered. And so the issues with postpartum can go much further beyond 8 weeks. And while I understand that this still has to be a time-limited thing, I find it very, very important that we support mothers in our state to be healthy both physically and mentally so that they don't just survive but thrive for the children of our state.
Thank you so much for both coming here today and testifying on that. Any other questions? We have a motion and a second. All right, very good. We have a second. Any other questions or discussion? If not, Madam Clerk, please call the roll.
Senator Rocky Adams.
Explain my I vote.
Please proceed.
I just want to thank Representative Mosher and Representative Cantrell. This is a great bill, so thank you so much for bringing it.
Senator Berg.
Also explain my I vote. I
Please
love
proceed.
both of you. I love both of you, and thank you for what you're doing, because this is exactly what we need to do to make women and their babies healthy and strong in this state. So thank you, and thank you.
Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howell. Senator Kerr. Senator Meredith. Senator Nemes.
I'd like to explain my vote.
Please proceed.
I'd like to thank Representative Cantrell and Moser for bringing this, because we preach a lot about encouraging women to have their babies, and I preach a lot about wraparound services that are needed. So this is a step in that direction, so thank you.
Senator Wise. Chairman Alvarado.
I'd like to cast my I vote and also thank everybody for coming today. This is a really important bill. I don't think everybody realizes that often Ms. Hudnall's story is one that's common, and a lot of women, after they deliver a baby, may have something unrelated. But if it occurs in that 1 year postpartum, it counts against us for maternal mortality and morbidity and other problems. And so our state has a poor ranking as a result of that. I do want to mention, I don't know if the cabinet is here or still online. I did speak to the cabinet about this, and I see the representative in the back about the coverage for this and the cost of this. And like I said, from my understanding is that they're able to cover this cost, and I see her nodding her head in the back. That would have been nice to have her come forward earlier, but they're able to cover this cost without having to have anything new as far as any costs or anything in the budget for it. So cabinet, if you'd like to come forward, yes, just really briefly. I know this is kind of out of the ordinary, but just to say that,
I was being brief.
yes, no problem.
Nodding seemed to be brief.
Yes, if you'd like to introduce yourself really briefly.
Kelly Rodman with the Cabinet for Health and Family Services, Legislative Liaison. The Cabinet had already been looking into this program in the Medicaid program. We were looking into it anyway. So this is just going to, it was an easier to have it as a bill, in all honesty. And we think we can absorb it in the cost.
So you think, or you will?
We will.
You will.
We will
Very good.
absorb.
That's what I
Excuse
needed to
me.
hear.
Let
Very
me
good.
correct that. Yes.
Thank you,
we
Ms.
will
Rodman. I
absorb.
appreciate that. Well, I cast an aye vote. With that, the bill passes with a count of 10-0. We'll entertain a motion. Very good. We have a motion and a second. All those in favor, please signify by saying aye. Any opposed? All right. The matter is on consent.
Thank you. Thank you so much.
We also have a title amendment on this bill. I'll need a motion on the title amendment. We have a motion and a second. All those in favor, please signify by saying aye. Aye. Any opposed? All right, the title amendment is adopted. All right, now we have the bigger bill, which I know will entertain a lot of discussion. Before we begin testimony on this bill, I know this is a bill that will spark a lot of emotions in a lot of folks, members of our committee included. There's people that are going to be for and against this bill for obvious reasons. I'm going to ask everyone to please temper those emotions if they can. I have a gavel. I don't want to use it to gavel anybody down. I'm going to give an opportunity to folks to express their views. I've saved this for last because it's going to take the most amount of time, and I wanted to make sure we had time for discussion on the bill. I've worked pretty hard on this through a lot of portions, a lot of changes made from the House bill. We do have a sub that's before us. And before we entertain that, there's going to have to be an amendment. Yeah, we'll adopt the sub. There's an amendment on it from a technicality we have to change in the sub. All right, very good. So with that caveat for everyone, I'm just going to ask everybody to try to keep emotions in check. Like I said, we're going to have a lot of folks want to speak on this. We're going to be limited on time, and I'm going to be pretty strict on that so we can get done in time to let people speak their minds. And then, if you hear me gaveling you out or interrupting you, please don't get offended. I'm doing that to try to keep us on track for this. Before we begin, there is a sub. It's PSS 3 that is in your packets. We're going to be working off of that document. I'll entertain a motion on that sub. We have a motion. Is there a second? Second. All those in favor, please signify by saying aye. Aye. All right. The sub is before us. There is going to be I'm going to make a Senate committee amendment. If you look at page 49 of the sub, under section 22, subsection 2, subsection B, number 4, it says shall be exempted from the requirements of section 20. That is supposed to be section 21 of this act. It's a technicality that will need to be changed. I'll entertain a motion. I'll make the motion to change that from 20 to 21. Is there a second? We have a second. All those in favor, please signify by saying aye. Aye. Anyone opposed? All right, so that amendment has been adopted. With that, we're going to, this is House Bill number 3. Again, it's an act relating to public health and declaring an emergency. The sponsor, Representative Nancy Tate. Representative Tate, if you'd like to come forward, introduce yourself. I understand you're accompanied by Adia Wuchner as well. If you ladies like to introduce yourselves for the record and then begin your testimony.
Thank you, Mr. Chairman and members of the committee. For the record, I'm Representative Nancy Tate, and I represent the 27th District. I will let my guests introduce themselves.
Thank you, Mr. Chairman and members of the committee. I'm Adia Wuchner, and Executive Director for Kentucky Right to Life. Thank you.
And then I believe I have a guest online as well.
Please introduce yourselves for the record.
Hi, my name is Katie Glenn, and I serve as Government Affairs Counsel for Americans United for Life.
Thank you. Please proceed.
Thank you very much. So I understand that we're at a time crunch, so I'm going to just basically breeze through each one of the sections and just give a high-level explanation for each one of the sections. So House Bill 3 has been referred to as a humanity in healthcare. Some have stated that its intent is to eliminate abortions in the Commonwealth of Kentucky. My response is that we've already done that with the assistance of this honorable body with the House bill, or the Heartbeat Bill, which was passed during the 2019 regular session. Rather, the intent of House Bill 3 is to ensure that while abortions are legal in Kentucky, we want them to be as safe as possible. Again, there are several sections. So the first section, the first topic is abortions on minors and judicial bypass. According to the Kentucky Annual Adoption Report summary from the Department of Public Health Office and Vital Statistics for period 2017 through 2020, Kentucky averages 13 children 14 ages and younger that have abortions annually. At a time when parents do not even want their children to take an aspirin in their schools without their parents' consent, and when the U.S. State Department estimates that 400,000 minors in the United States are involved in human trafficking, this measure states that physicians must exert measures to ensure that parents of minors seeking an abortion are consulted. Judicial bypass was upheld by the U.S. Supreme Court in 1990 by the Jane Hodgson versus Minnesota. Judicial bypass raises the standards of who meets the merits to obtain a judicial bypass if parents and legal guardians they're not available and they are not. It is not in the best interest of the minors to get them involved. Modifications have been made to the data required for the Vital Statistics Report and grants the Office of the Inspector General oversight of abortions, reporting, verification, and compliance. The second topic and the bulk of this bill is in regards to chemical abortions, with regulations that will be put in place to respond to modifications that the FDA made to their realms concerning the chemical abortion-inducing drugs. For 10 years, the FDA has prohibited abortion-inducing drugs from being dispensed in pharmacies, the brick and mortars, and online, and via telemedicine. While Kentucky prohibits prescribing the abortion-inducing drugs via telemedicine, we are now forced to respond to the changes that the FDA made on December 16th of 2021. The third topic addresses the dignified disposal of fetal remains. The U.S. Supreme Court upheld language in 2016 in the case known as Christina Box, Commissioner, Indiana Department of Health versus Planned Parenthood of Indiana and Kentucky. Also in 2019, the Ohio Attorney General Mike DeWine reported findings that Planned Parenthood was disposing of fetal remains in landfills in Kentucky. This information infuriated me and spurred me to investigate and adopt the language upheld by the U.S. Supreme Court, which prevents human remains from being treated like medical waste. Also, new regulations outline how a baby's body should be handled after an abortion and allows parents how to bury their children for spontaneous abortions. The fourth topic is language known as the Hyde Amendment, with the intent of tightening regulations on the use of public agency funds, and clarifies that all monies that are public funds, regardless of the source, cannot be given to any institution that performs, induces, refers to, or counsels for abortions. The fifth topic is in regards to complications, creating regulations for hospitals, healthcare facilities, and physicians to report complications of death as a result of an abortion complication. This section states that each prescription issued for an abortion-inducing drug, that a report form shall be signed by the qualifying physician who provided the drugs and transmitted to the cabinet. The report will include the drug administered, complications, or adverse effects, and level and type of intervention required. According to a recent report by Medicaid, between 2000 and 2015, emergency room visits have gone up 500% from complications due to the chemical abortion pill. The sixth topic allows the Attorney General to demand from the General of any state the surrender of any person found in the other state who has been charged in Kentucky with the crime of violating the distribution of chemical abortions. Mr. Chairman, at this time, I welcome questions and concerns.
Thank you. I appreciate it. I think what we're going to do is, before we take questions, we have people that are here to speak in opposition. We have one member who's particularly opposed to this, and I want to give that member an opportunity to speak. Senator Berg, I'm going to invite you if you'd like. I know you have some things you want to talk about this bill. If you'd like to come forward and present information at the table, I welcome you to come forward, and I'll give you 5 minutes to talk about your opposition to the bill. Please introduce yourself for the record and then begin when you're ready.
Senator Karen Berg, District 26. First of all, Chairman, I really appreciate you giving me the opportunity to testify. I did not know that I was going to be given this opportunity, so I do not have prepared comments. But you all know me well enough to know that I'm a doctor. And I'm not here to legislate morality. And I honestly, truly believe that the opposition I honestly believe that this bill is very poor medicine. It does not support the science. In fact, the Journal of the American Medical Association just this week devoted an entire section of their journal, including their op-ed, that clearly states it's time to change the standard of medication abortion. And just real clearly, I want to, because people don't understand, words matter. Representative Tate is talking about chemical abortion, and to me, chemical abortion would mean you instill a chemical into the uterus in an effort to create a miscarriage. Medication abortion, which is what we're talking about here, is you take pills. These are pills. The first pill is an anti-progesterone pill. You know, people think that women live on estrogen, men live on testosterone, but pregnancy is supported by progesterone. So the first pill is basically a progesterone antagonist. It just lowers the amount of progesterone in your body. The second pill, which you take 24 hours later, softens your cervix and causes your uterus to contract. And there are women on the committee today, and any of you all who have ever had menstrual cramps will understand what it feels like when your uterus contracts. So normal function of the uterus, all this pill does is potentiate it. And that's what we're talking about. We're talking about a procedure that is done for women who are less than 10 weeks pregnant. Okay? So this is an extremely simple, extremely safe procedure that the American College of Obstetrics and Gynecology and the American College of Medicine are both saying loud and clear. This is safer than surgical abortion. It is more private for women. It gives them more efficacy over their own body and their decisions regarding their own reproduction. In fact, the conclusion of one of the articles, the title of this article, again, this is from JAMA, published on March 21st, 2020. How relevant. Given the high effectiveness and very low risks associated with omitting in-person tests and using history-based screening alone, no test medication abortion can offer substantial benefits to clinicians and patients and is consistent with the principle of patient-centered care. They go on to conclude, these benefits have the potential to increase equitable access to abortion for all patients, particularly marginalized racial and ethnic groups, those with low incomes who reside in rural locations and who face greater barriers to abortion care. Clinicians should eliminate unnecessary tests to support patient-centered care. Now, what this bill takes telemedicine for abortion care and makes it illegal in this state. Now, remember, guys, we've all been through this long session. We're getting to the end of it. We have expanded telehealth coverage for virtually every other branch of medicine in this state that we could. Kentucky is actually leading the way in this endeavor because we know we have access problems. We know we have people in communities that cannot reach safe, effective health care. And our goal is to try to fix that, not to make it worse.
Senator Berg, I appreciate that. We're at the limit. I'm going to have other groups come forward. Appreciate your testimony. We've got several folks that want to come forward. I know we've got Kate Miller with the ACLU, Tamara Weeder, and if I mispronounce names, please forgive me. Sarah Hall, Aaron Smith, Mickey Adams, and I'm the person who's got a long last name himself. I'm going to make an attempt here. Nicole Agalianda Stajerdi. Is that right? Close enough. Thank you. I say that myself quite a few times. I appreciate y'all. If you all want to come forward, grab a seat, introduce yourselves, and I'll allow each of you a couple of minutes, provide a bit of testimony. Ms. Miller, I understand you've got one concern that might warrant a bit of an amendment for us, so we'll be able to hear a little bit of testimony on that for the floor. But please begin. If you want to introduce yourselves for the record, make sure your microphone's on and begin your testimony.
Oops. Okay. Hello, my name's Kate Miller. I'm the Advocacy Director at the ACLU of Kentucky. Chairman, would you prefer that we all introduce ourselves and then begin?
That would be great, yes.
Tamara Weeder. I'm the Kentucky State Director for Planned Parenthood Alliance Advocates.
Nicole Agalianda-Stajerdi. I am a Kentuckian and one of your constituents and a former legislative intern of this chamber, actually.
I'm Amelia Adams. I'm an attorney, and I take young women through the judicial bypass procedure.
My name is Erin Elizabeth Harden Smith. I am the Executive Director of the Kentucky Health Justice Network, based out of Louisville, Kentucky.
And my name is Sarah Hall. I'm a Regional Field Organizer for Planned Parenthood Alliance Advocates.
Okay. Chairman and members of the committee, thank you so much for allowing us the opportunity to testify today. As I said, my name is Kate Miller, and I'm the Advocacy Director for the ACLU of Kentucky. And I'm going to try to be very, very brief and also not knock over any of these things and keep pretty close to the microphone. So, of course, I think you all know the ACLU's position on access to abortion. And so I'm not going to spend a lot of time discussing that today. What I do want to discuss are some very specific provisions to the bill where I think we can find some common ground. I want to start by expressing my appreciation to the sponsor, Representative Tate, who's been very responsive to our requests for meetings and emails and conference calls. And I am appreciative of the chairman for making changes alongside the sponsor when it comes to HB 3. So as I said, I'm just going to focus on a couple of areas, and the first one is privacy. And I think there's a lot of common ground here. I hope that there will be. So the bill already addresses privacy throughout its 63 pages, but I think there are still some remaining omissions. One significant omission was addressed by making the birth death certificate optional. Unfortunately, what we did not know is that when and I can show this to you on page 46 of the committee sub, it's line 26, that there is existing KRS that requires a death certificate in order for remains to be cremated, which of course makes a lot of sense. KRS previously had an exemption for fetal remains. That was struck in the bill. I don't think the intention there was to compel individuals who have had abortions or compel individuals who have had miscarriages to file a death certificate. I think that was an unintentional error, and that's something we missed when we were having these conversations with Representative Tate. Next, I want to touch on minors. The bill also requires, I believe in section 21, that all parents of minors be notified of the disposition of remains. I think unintentionally that notification is also required for minors who have received a judicial bypass. And so, of course, if someone's gone through the process of receiving a judicial bypass, we think it's pretty clear that the judge has deemed it's in their best interest to keep this private from their parents. So again, it's a totally different section than the judicial bypass section. Two more very quickly. I'm so sorry, trying to explain this as best I can. Pathology and law enforcement, two things that I have no understanding of, but at the bottom of section 21 on page 49, the bill lays out when fetal remains can be transported. It says you can only transport fetal remains in like this 4 or 5 situations. And it doesn't include the situation of transporting fetal remains to a pathology lab or to law enforcement. And so there are instances of abortion or miscarriage where you would want to have pathologists review those remains in order to establish a diagnosis. And there are instances where those remains may be evidence of a crime like rape or incest, where we would want them to be transported to law enforcement. And then finally, I think the emergency clause, I think, remains in the committee sub. There are certain elements of this bill that could go into effect immediately, but quite a few administrative regulations need to be promulgated, and we don't think that that can be done immediately. And so no one will be able to comply. And that's not just in regards to abortion, but pharmacists, hospitals. Thank you. So those are the main provisions. As I said, of course, you know, the ACLU believes that decisions about pregnancy are personal, can be complicated. The best person to make that decision is the pregnant person. But this is a good faith effort to come to the committee and to come to Representative Tate and urge you to adopt these very simple recommendations. And we would be very happy to help with those. And I'm going to turn it over to these more valuable voices and go sit down over there.
Hi, thank you. Like I said, my name is Tamara Weeder, and I'm the Kentucky State Director for Planned Parenthood Alliance Advocates. I'm here today in strong opposition to House Bill 3. This bill piles on a long list of abortion restrictions, none of which are based in medical best practice and patient safety, and all of which will harm abortion patients and providers and make it impossible for Kentucky patients to get the care they need. Years of medical research has demonstrated that legal abortion is one of the safest medical procedures in the United States, with low mortality and complication rates for patients. In fact, the overall abortion complication rate is approximately 3 times lower than that for wisdom tooth extraction and about 3 to 4 times lower than that for a tonsillectomy. Women in the U.S. experience major complications less than 1% of the time. We know this because the FDA collects robust information about abortion safety and adverse events, including complications such as ectopic pregnancies and hospitalizations that do not result in deaths. This data has been collected continuously since the FDA first approved the use of mifepristone for early abortions over 2 decades ago. The most recent FDA report on abortion complications, which includes data through June 2021, continues to affirm that complications are extremely rare in the United States. It also notes that, if anything, the reports actually overstate the rate of complications for medication abortion because they include all adverse effects, even if they were likely to be caused by something else, such as suspected homicide. Given abortion's incredibly strong safety record and the fact that it is already the most regulated drug regimen in the United States and any other medical procedure, not only in the United States, but here in Kentucky, it is important to understand that none of the requirements in this bill are backed by medical best practice, as we just heard from Senator Dr. Karen Berg, or supported by leading medical organizations. For example, the restrictions on medication abortion directly contradict the FDA's updated recommendations for medication abortion. In December, the FDA listened to decades of data and overwhelming advice of medical experts and removed the medically unnecessary requirement that medication abortion be dispensed in person, a requirement that doesn't apply to any other drug that patients can safely take at home. This bill undoes the progress that was made with the FDA's recent changes and takes our state backwards, forcing Kentucky patients to use an outdated standard of care that pushes abortion out of reach for many, creating a new layer of bureaucracy simply because the available science doesn't support a political platform. In fact, the additional requirements in this bill are so burdensome and unprecedented that there is no way providers and state agencies would be able to comply by the time this bill goes into effect. This bill has an emergency clause, as Kate said, and with the immediate effect of this date, if it passes, these requirements will be overwhelming. We won't be able to comply. The pharmacists, the hospitals, Planned Parenthood, EMW, Things like developing a certification process in various forms and materials would take time for the state, and obtaining certification and complying with a long list of other requirements in this bill will take time for providers if they can comply at all, given how harmful and burdensome the requirements are in this bill. Attaching an emergency clause ignores this reality. It is clear that this has nothing to do with patient safety. The intent of this bill is to put in place requirements that are so burdensome that they are impossible to comply with. What Kentuckians need right now is not more restrictions on care. We urge you to oppose this bill.
Right, we've got about 4 minutes remaining. I think eight have been taken by the first two presenters.
I will try to keep this brief. I am here just to share part of my story with you, not really because I want to, but because I feel like I have to. When I was 6 years old, my stepfather sexually abused me for the first time. I hid in my closet until my mother came home from work that day, and I tried to explain to her what had happened to me. I heard her talking to my stepfather about what I said, and then I heard her say, "If it happens again, you'll have to leave." It did happen again, and again, and again. For 6 long years, he did what he wanted to do with me, while no one was looking, until my mother got up enough courage to leave him when I was 12 years old. Luckily, I was not able to bear children during that time, but if my body had been able to reproduce, and if I had gotten pregnant while HB3 was in place, the barriers to abortion care would have been insurmountable for me. You see, I can tell you that my mother would have been supportive of an abortion, but I didn't get my first ID until I received my learner's permit at age 16. My biological father had moved to Florida after he and my mom divorced. They had no contact. I have no idea how my stepfather would have reacted to me being pregnant, but I can tell you this. Telling him quite possibly would have placed me in more harm. My stepfather was a functioning drug addict and alcoholic who was as charismatic and charming as he was cruel and abusive to both me and my mother. My mother never pressed charges against him for anything that he did, in part because after the first time, I kept what was happening to me to myself. You see, for me, if I didn't tell anyone, it was easier to pretend that it wasn't happening. We were heavily involved in church. He was a deacon. She was an associate minister. She didn't leave him until our pastor told her to do so after witnessing a violent interaction one night. You see, as much as you all might want to turn a blind eye to the fact that women and children in Kentucky are being raped every day, the numbers tell the story. Kentucky has the highest rate of child abuse in this country, and I am looking at the folks who have the power to create policy for good, but consistently choose otherwise. In the name of what? Protecting life? How are you actively protecting life once a child is born? How would you actively protect her? This is a photo of me when the abuse was actively occurring. How would you explain to her that despite the suffering, excruciating abuse and trauma because of HB3, she now has additional hurdles to jump through to obtain the health care that she would need to salvage whatever part of agency and childhood she had left? And those hurdles are more than administrative barriers. They are hurdles that put her in harm's way again because the consent she needs would likely have to come from the person who is actively abusing her. And when that abuser realizes that obtaining an abortion might shine a light on what is happening in the home, I hope that you can imagine the lengths one might go to keep that kind of information from getting out there. It is not a surprise that these situations aren't being considered when the author of this bill has publicly said in a committee hearing on her bill that she would be okay with a 13-year-old rape survivor being forced to carry a pregnancy to term. How can you ignore this? Let me tell you something, and I'm wrapping up, I promise. Abusers come in many forms. Most are unassuming to the outside world. They have to be, otherwise they wouldn't get very far. The best abusers, the most successful ones who cause the most harm, are the ones who are really good at manipulation. The commitment to this bill and the way legislators have used it as a tool to say they are pro-life is manipulation at best. Senators, if you pass this bill, the only thing that you will have accomplished is further traumatizing women and children who are already in the most painful situations. I am urging you today to stop attacking people who are already being attacked and vote no on this cruel piece of legislation. Thank you.
Ladies, we're at the limit here, so just very briefly, if you'd like to make your comments.
I take these young women through the judicial process so that they can get a judicial bypass. That doesn't mean they get an abortion. It just gives them their options in front of them. She comes often from a broken family She's often abused by either parent, either physically or sexually, like this young woman here. She gets little or no guidance regarding reproductive issues from her parent. I had one client who finally got her birth control pills, and her mother found them and said, "You can't take them because no daughter of mine is going to have sex before she's married." I mean, this is ridiculous. It rises to the level of incomprehensible. The idea that this bill will make it more difficult to these children, and some of my clients have been as young as 12 years old. It will disproportionately affect young women who are experiencing domestic violence, who are experiencing sexual abuse, who are from low-income families, who live on the street or in their mother's car, living in foster care, or who are otherwise transitory. Minors seeking an abortion, actually just the right to an abortion, already face a barrage of obstacles. They have to find out about the judicial bypass option. They don't have to go to their parent, who may put them out of the house if they find out there is a pregnancy. Can you imagine a 13-year-old being forced to carry a pregnancy to term? It's incomprehensible. I want to conclude by letting you know that these girls that come in front of me and say, "I need to talk to you about possibility of an abortion," they are almost always older than their years. They don't enter into this decision-making process lightly. They are scared. They are shamed. They are brave, amazingly brave. If asked, they will tell you that someday they want to have children, just not now.
We appreciate the testimony, lady. We're well past our limit. We've had 20 minutes of opposition, which I think is probably 4 times longer we've heard from the proponents. I appreciate you all coming forward. We're going to have the proponents of the bill be able to come back and be available for questions and respond to some of the comments that have been made. We thank you all for coming today.
Are we being thrown out? Yeah. Yeah. Okay.
Representative Tate, if you'd like to make a few comments, and then we'll open it up for questions from the committee.
For the sake of time, Mr. Chairman, I'm going to let Adia and also Miss Katie respond.
Thank you, Mr. Chairman and members of the committee. And Chairman, thank you for all your intensive work that you also put in this committee sub. I think it's much different than the first bill that we've seen, and much of improvement. But I wanted to address a few things that were said, and respectively, and we've been working, of course, with the ACLU on many issues. But, you know, we have to understand that from their own Reproductive Freedom Act, most of the legislation that you have passed in the last few years protecting or guiding women who are seeking to end their child's life or seeking an abortion in your abortion laws are part of their concerns. The fact that a minor child on their own website, they find it wrong that a minor child would even have to have their parents' permission for an abortion. This is the same child that would not be able to take an aspirin in school, not be able to get their ears pierced. But the law does allow this judicial bypass process, and all this bill does is enhance that process, updated with revisions that have been upheld. When it comes to the issue of the terminated care for the terminated remains in a dignified manner. That piece of legislation that was incorporated into this bill has been upheld in the courts. The other piece, as we worked with, is we began where there was a lot of confusion with the Board of Medical Pharmacy, Board of Medical Licensure. But I think in the wisdom of reworking this legislation, it basically says if a physician or a provider in the Commonwealth of Kentucky, a physician, wants to enter in as a non-surgical provider, there is the same pathway and the same that an abortion facility would have, registering with the cabinet, seeing the patient before. And often, let's think about this young woman who's coming in to, no matter what their age is, to look at possibly ending the life of her child and ending her, terminating her pregnancy. It may be, and long the General Assembly has worked wanting people to have a medical encounter, a medical home. We know that Kentuckians do not often seek the medical care that they need. So here we're saying, on this case, the first time that you may need gynecological care, just get it through the mail. That's okay. And so what this does is say, this is about women's health. We want you to be seen by a medical provider in the Commonwealth of Kentucky, and it lays out the ramifications and the process for that to be done, and then the continued reporting that's already in place with the cabinet that's set up for other providers, and the vital statistic reporting form that's also used when these medications are prescribed in Kentucky that is already in existence. So it would just require those wanting to enter into the field, if they should, to follow those same procedures. But why wouldn't we want that woman, no matter what her age is, to see a medical provider, no matter what her stage of pregnancy is, versus getting those medications through a mail order from out of state or a mail order distribution center? Thank you.
Okay, we're going to open up for questions for members of the committee. We're going to limit this, obviously, because we're up against the clock. So if any, Senator Harper Angel.
Thank you, Mr. Chairman. During the last several years, at least 10, the General Assembly has made great strides in passing legislation that protects victims of rape, beginning with the counting, testing, and clearing the backlogs of untested rape kits, training for police officers. Just last week, we unanimously passed legislation to make incest a violent offense, which means the perpetrator serves serious time. So my question, Representative Tate, is in your House Bill 3, is there any exemption for a victim of rape or incest?
There is not. And what I have done is I have not changed the policies that have been passed. I have not changed that provision at all. You know, in 2017 was the first year that pro-life legislation was passed by this honorable body. And up to this point, I'm completely following the process that has been established, and there is no provisions. Now, one of the things that I have not changed that at all. One of the things that I want to point out, too, as well, is that one of my best friends she was conceived from rape. And so what I think is that would be the ultimate punishment of death for the child in the womb that is conceived from a heinous crime. So I don't know why that we want to give the ultimate death. These children deserve the right to live. They're beautiful children as well.
Follow up, Mr. Chairman.
I'm sorry.
Please, if you have a response, please,
Yes, please.
proceed briefly.
Could I just add that in the judicial bypass section of the bill, there is an exemption that if the parent or guardian who would be the person giving consent for the abortion is the abuser, that their consent is no longer needed. So the bill does specifically speak to that tragic situation where the parent is the abuser.
Senator Harper Angel.
Thank you, Mr. Chair. The title of the bill about women's public health, if this does not include victims of rape and incest, it's a false statement. Thank you, Mr. Chair.
Thank you. Any other questions from members of the committee? All right. If not, we have Senator Berg.
I had a question relating to cost-effective medicine and cost-effective delivery of healthcare, which is, I do believe, an overarching stated goal in that we as physicians provide medicine and good quality health care to patients in the least restrictive and most cost-effective manner. Do you believe that your bill follows those guidelines?
Wouldn't want to respond to that. I have a response, but I would allow my presenters here as well.
I would just say that we're really, if you think about it, we're really not changing anything that's been going on before. Before, prior to this, what we're talking, when we look at the aspects of medical, surgical, chemical, abortion, prior to the change in December, they were seen at the abortion provider clinics in the Commonwealth of Kentucky. Now, the law changed, or the FDA changed, to open it up for this to be mail ordered. So we're not addressing or changing anything. What I really want to commend the General Assembly is, and you just passed just unanimously a few minutes ago, extending the much needed care to those we often talk about the women who have children, the much needed care to women postpartum for a year. Or the bill that is a hallmark in Kentucky, and that is that women who are pregnant are no longer shackled in the prison systems or in solitary confinement, and respectively, Senator Rocky Adams, that became a national hallmark bill. So I just say you've done so much, and you continue to do so much work that's extended for women, pregnant women.
All right, and may I follow up with that?
Please
remark,
proceed.
sir?
Yeah.
Thank you. For the purpose of time, yes, thank God we no longer require women in the state of Kentucky to give birth in shackles. That's awesome. Yes, we are going to allow women who have just had a child to have Medicaid coverage for a year. That is amazing, amazing movement forward. But what this bill does to its core has nothing to do with the safe delivery of health care. It has everything to do with creating so many hurdles and so many barriers that the two remaining providers in this state will not be able to meet them and stay open. And if you do not state that as the intent of your bill, it is clearly written in every line of your bill. A requirement to tell women that this is a potentially reversible procedure is so antithetical to medical data that honestly, medical literature says even exploring it is unethical, that it is not even ethical to do the research to answer that question. But yet it is a requirement in this bill. Another requirement to dispose of fetal remains. Now, if you believe that a fetus in the womb is an actual life, do not have an abortion. And I will stand behind you, and I will support you, and I will protect you, and I will vote to cover you with Medicaid, and I will do everything I can to help you. But the decision belongs to the woman. It is not your choice to say this is a morally reprehensible thing to do. It is my choice to decide if this is something morally, ethically, religiously, and medically that I want to do. And this legislation, no matter what you call it, no matter what you say about it, is designed to limit that choice. And Representative, I know we disagree with each other. I know that you believe at conception that those two cells have life. I believe that actual life, the life of the mother, takes precedence over the potential life. And this is not a medical question. This is a religious, moral, ethical question that we have no business legislating.
Dr.
May I
Bird?
respond to
Thank
that
you.
real quickly?
Yes, thank you.
Just 1 second,
Please
just real
proceed.
quickly. And she's absolutely right. We do absolutely completely disagree. But one of the things that I want to point out too, according to the vital statistics for the Commonwealth of Kentucky, in 2020, and the report published for 2021, there were 4,100 abortions that were committed in Kentucky alone, of which one was for the health of the mother. Typically, whenever there is the health of the, I'm just talking about the intake form from the vital statistics. May I respond? And so typically, when the life of the mother is being challenged or is at risk, we don't go to abortion clinics. We go to hospitals. I know whenever I had my health issues when I was pregnant, I sought my doctor, my OGBYN, and I went to a hospital. It's not done at an abortion clinic. And I also want to point out one other thing. You said that this bill actually prohibited telemedicine in the Commonwealth of Kentucky. That legislation was passed in 2019. This bill does not change that at all.
All right, I think we've had, like I said, I knew this was going to have a lot of discussion. It's heated. I appreciate the tenor of everybody here. It's so I appreciate that. I know a lot of discussions, and there'll be an opportunity for the voters to vote on this issue this fall. There's a constitutional amendment on the ballot that the voters of Kentucky will speak on this issue as to whether or not they want to put that into our Constitution, if whether or not we think that this is a constitutional right or not. So I want to just reiterate that as a doc, I don't think any medication was ever designed to terminate life. And I know this bill has a lot to do with that. And I know that the discussion is often about when life begins. That becomes the issue. And if all lives have the same rights or not, if some have more rights than others. We've heard differing opinions on that here today. And some of us feel like we have to speak up for those children who can't speak for themselves. All right. Appreciate everybody's tenor. I think hopefully both sides have been heard on this here today. This has been a difficult bill for me to work on, one of the more difficult ones I've had to work on. I'm willing to entertain a motion on the bill. You have a motion. Is there a second? You have a second. All right, Madam Clerk, please call the roll.
Senator Rocky Adams. Aye. Senator Berg.
No, and I don't know that I need to further explain my no vote, but, I think I see this bill as a effort to legislate morality, and I know that many of the people on this podium, many of the people in this room, believe that it's morally wrong to terminate a pregnancy. And what I think is morally wrong is for the government to come in and tell a woman what she can or cannot do with her own reproduction. Now we are talking about early stage, 10 weeks or less. We are talking about an extraordinarily safe medical procedure, one of the safest that exists and far, far safer than childbirth. So the only reason we are here is because some people think this should not be allowed. And what I think should not be allowed is people that have no business in the decision legislating this decision. So thank you.
Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 8-2. It'll be reported favorably to the Senate floor. I think there may be a couple more tweaks we may need to do for this bill, so there may be an amendment coming just for a couple of things based on the testimony we heard here today. Thank you all members for being here. We do need we do need to have a motion actually to roll the amendment into the committee sub on this bill that we did earlier. Do we have a motion? You have a motion. Is your second? Second. All those in favor, please signify by saying aye. Aye. Anyone opposed? All right, that amendment's been rolled into the sub. Thank you all for being here today. Thank for all of you who have come here today to provide testimony. We stand adjourned.
Thank you.